Most pregnant women living in the U.S. would go to a well-prepared hospital with the proper nurses, medicines, and supplies needed for childbirth, but not for the women in Latin America. Most women living there give birth at home without proper medical assistance because of the lack of hospitals, nurses, and medicines necessary for the process. Mothers are even buying medical supplies off the black market just to sustain her and her child. Healthcare is something all people need, from things as small as a broken finger to big as a open heart surgery. However, Latin America has it tough with a shaky healthcare system and almost no system at all. Latin America is one of the most unequal regions in the world, and it shows in its healthcare, which has been walking on thin ice for years. From the quality to how it's distributed among the population, there have been many attempts to trying to improve certain aspects within Latin America's health system, like giving out free health services to all inhabitants in a specific country, have been successful and displayed improvement. But there have still been many failed attempts at different solutions, and Latin America still struggles greatly with their healthcare. The power struggles within the healthcare is an issue, too, and a big part of it comes from the inequality and unequalness of how different social classes are treated when it comes to distributing all the different parts of the healthcare system. The power struggle in Latin America within the topic of health is the way different classes of people are treated when it comes to distributing the different sections of the system. For example, many people who are rich and wealthy and can support themselves and their family are given acceptable, great quality health care, which is often private and insurance, while people who are poor and underneath the poverty line are given little to no access to any sort of health services and are not handed out any insurance. There are the 5 health challenges. So why does the healthcare system in Latin America play by these rules? What makes them think this is okay? The power struggle impacts the social structures in the society by a whole by making it very obvious the people who are on a higher class than most of the population should be treated best and given the most benefits possible, possibly just to match up with their lavish lifestyle, and the people who are the lowest class should be given anything of nice quality they aren't used to, almost like they shouldn't be given any chances that could possibly benefit them. It's almost as if wealthy people in Latin America are honored like a god, while poor people aren't even treated like humans and are blocked from existence in this unequal country. Although Latin America has followed this distribution system for years and think that everything is okay since they've been doing it for so long, the country is actually hurting their population, their citizens, with this system. By giving poor and homeless no attention regarding to health, more people die from deadly diseases at a younger age. Those diseases are a higher chance spreading to other parts of the population, causing more and more people to die at faster rates. All of the issues cause in a domino effect. One domino falls, knocking the one in front of it until all the dominoes are knocked over. In this case, power is manifested by a social hierarchy. There are different types of classes in the country, all ranked by a class at the top being the highest and typically the most wealthy, and the class at the bottom being the lowest and the poorest. Many social hierarchies are based on how much wealth someone has, or how much power in this case. It is much wealth people have. There are many motives for obtaining power, but one of them includes greed. One could become jealous of someone who has some sort of power, whether it's a little or a lot. People Power is something that can be drawn anyone in immediately, and people become hungry for it once they witness or experience the things they can do when they obtain power. Power can discriminate and isolate by using to it, often by using it to past your abilities. In the topic of health, the use of a social hierarchy is obvious when it comes to the distribution of the different types of services. In Latin America, the inequality in the healthcare system and the country in general is very rocky and unpredictable. People never know what is going to happen next with the system. There have been many endeavors to try and improve the healthcare in Latin America and the health of the citizens in the country, but it seems to be that things return back to its original state, with lacks in resources and hospital beds, and even doctors to wealthy people given the best care possible, or poor people given little to none at all. Latin America still has a long way to go in repairing its healthcare system before it falls apart.